I'm going to hand off the mic. Bring up your guests.
Thank you. So I will let my guests introduce themselves. It's a pleasure to meet you all. Good morning. So first, Christina. Christina is the CRO, Chief Revenue Officer of Kranz and Associates.
Good morning. I'm Christina Bowie, Chief Revenue Officer at Kranz and Associates. We've been around for over 25 years serving venture capital funds and their portfolio companies. So we are the outsourced finance team. We provide finance consulting, CFO advisory for currently over 300 portfolio companies from seed stage through exit and close to 70 venture capital firms.
Thank you. So obviously she's a superstar. Mel?
Good morning. My name is Mel Gunawardena. I'm a managing partner of two companies. One is called Synergen Health. It's a tech-enabled revenue cycle management company. In short, we follow the money for healthcare clients so that they could focus on taking care of their patients. The other one is an IoT-based solutions company called Synergen Technology Labs that we launched in 2014. Both companies are self-funded. Our focus in the IoT-based company is to provide solutions around telehealth and remote monitoring. One of the products that we are launching next year is in cardiac telemetry monitoring, and the other one is in baby monitoring, which has a service side of it, which is a direct-to-consumer product. The other one is a clinical-grade product, which is prescribed by physicians. So thank you for having us.
Thank you, Mel. Reza? You have your own.
I have my own microphone. I'm special. Hi, everybody. I am Reza Kazemipour. I am CEO of a consultancy called 1792. And if you're wondering why I named it 1792, it's the year Wall Street was created. Just as a small tidbit. I have two companies. One is a consultancy that helps a lot of startups here in the Valley and also in the UAE, and I'll explain more about that. I work in three different buckets. One is to help commercialize companies that are going through that stage. The other is for fundraising, and the last bucket is for M&A activities. What I do with that is I'm using that to work with family offices in the UAE and here in the States to help them raise money and help them build partnerships and collaborate with a lot of the health tech, fintech, and IoT companies and partners in the Middle East. That's it.
Thank you, Reza. And finally me, I'm KG, and I am leading Quarrio, a company that essentially works with helping you ask questions in natural language out of your corporate data sources, and it answers you back in free-form language. So one of the things that we all hear about all the time and that we want to take up in this panel is that data is growing exponentially. Not only is data growing exponentially, but the uses for data are growing exponentially. But the number of people able to work with data who can become data analysts is growing at a low linear rate, somewhere between 3 and 4% per annum, if you're to believe Forrester and Gartner. That means that we're effectively becoming dumber and dumber every day that goes in order to, in how we can utilize data for information and decision making. So that's what I want to speak to these illustrious people about. How can we overcome that gap? And what is the state in the enterprise and why? So the first thing I want to ask is, to what extent have you guys seen this problem with excessive amounts of data but inability to utilize it for information?
In my job as Chief Revenue Officer, I need to focus on better alignment and integration among all the revenue-related functions: sales, marketing, client support, pricing, revenue management. And I have, have a history of 1,000 companies that, at different stages, they need, they have different needs and desires, and the market changes with the economy, whether it's a capital raising outlook, whether it's an exit outlook. I need to understand where my clients are, what they need, when they need it, and I can't get that information. Also, it takes time to log into the CRM and get the reports that you want, because you have to customize the reports. And we have so much data in our 25-year history that we need to glean from. And it's very hard to get it right now unless we manually, hopefully, go through that.
Thank you, Christina. Mel?
Yeah, so I take a different view on our industry that we're in. So we're in healthcare, and there are multiple stakeholders in healthcare. There's a patient. He or she is looking to get better outcome at lower cost. Then you have the healthcare provider who's trying to get better outcomes, also to get paid for their services. Then you have the insurance carrier who's trying to mitigate his cost. And then there are companies like us that are in the administrative side of the business. And there are so many data sets that are there. And it's, healthcare is all about data at the end of the day, but it's in disparate systems. And that's one of the biggest challenges that we have in healthcare, is how do you use that data to make the decisions? So if you look at a physician side, just from a clinical aspect, you would not go to a 30-year-old resident who just completed his services if he's an oncologist, because you want to go to an older physician because they've got the experience. One of the reasons that today, it's not an issue with technology. I think it's one of the biggest challenges is how do you get all that data? And in healthcare, because of the regulatory issues and system issues, we can't get access to the data that we need at the right time. So these are some of the challenges that I see. This is just in the clinical side. In our administrative side, when we are processing claims, the goalpost is being changed by the insurance companies all the time. So how do you look at that data and figure out what data points should we look at to make the right decision? So in healthcare, that's one of the challenges that I've been seeing.
Those are all great points. One of the areas that I see, if you go back even a decade ago where AI wasn't really AI yet, I worked for a small company called IBM out of New York. And one of the ways we leverage that is internally from an HR perspective is to see how people are communicating internally. What things are they saying without anonymously, without pinging people, to see exactly what was going on. What that helped us with what Christina was saying from a customer perspective. How are they talking about customers, partners, and how business is flowing on an everyday basis? From that, the AI would kick in and give recommendations to the senior officers for the company and divisions to what types of things they should be saying, doing. So I don't necessarily think it's a problem, but if anything, it's helping us more and more on a daily basis. Now, of course, what that does, it puts less time from us, from a management perspective and thinking process, but it helps us from the recommendation side.
Thank you. How many of you guys know the difference between facts, data, and information? Sir? As a good definition. So the difference between facts and data is the actual structuring and the ability to retrieve it at will to use, right? The difference between data and information is context. And the way you get and apply context is by asking a question. So in terms of corporate environments and in terms of AI, as we're talking about it now, by the way, this came from Jim Cates, who was the global head of R&D for IBM, right? So to what extent do you guys sit with data, and how do you today turn that data into information?
Again, that's a great question. I'd say probably every second of everything I do is the amount of data that's coming into my phone from my emails, from everything I look at. And that makes, again, going back to the decision-making process as a senior manager, especially in a corporate setting, on how I should be thinking and what I should be doing on a daily basis with my employees to make a better decision. If that makes sense.
Yeah, I mean, for us, I would take one of the IoT companies that we work with. The cardiac side of the business, we are tracking beat-by-beat heart rates and to figure out what the arrhythmia issues are. And a normal person has about 115,000 heartbeats per day. And so to be able to, if you have 1,000 people, it's 100 million heartbeats in a day, how could you track each one? So for us, we have to use technology to figure out, what has issues, what doesn't, so that we could focus on. And technology like AI is the one that can help us, because otherwise you'll have to have an army of people to be able to look at this data.
For us, we're beginning to look at automating some of the more menial tasks, like the bookkeeping, but then we have to verify the data, and there's still needs for folks to verify what the robotics is doing. But ideally, we would like to move to having the more menial tasks of bookkeeping and accounting move more into to AI automation.
So given that all of us are working with AI and automation, what are the dangers around this? What are the massive mistakes that you guys see coming along around AI? Could you guys talk a little bit about the dangers around AI in corporate settings and how we can mitigate this?
Well, I think in anything, if we don't have the proper data, you'll get false positives. So if you're getting incorrect data, you'll make the wrong decision. Again, going back to a corporate setting, that's really the biggest thing, is if you have the wrong feeds coming in, the machine's not learning, so the AI won't function properly.
So data quality.
Data quality is absolutely 100% key.
Okay.
Yeah, the other part of it is, do you have the full set of data, right? So you have to have enough data, and I think what Reza was talking about, AI can provide false biases. I think it can enhance the false biases, and that's the fear that you have in that. Yeah.
For us, we are a relationship business, and we are a people business, and our clients want to be heard, and currently we're doing a massive client survey, calling everybody to understand what their needs are. And data is and technology is takes the relationship and the people touching people out of it.
So as we're talking, we're coming across and we're looking at data from a corporate decision-making perspective. But ultimately it comes down to money, right? How much money are you willing to spend on data quality? How much money are you willing to spend on getting a complete picture? And how do you fit that into your relationships? So Christina, could you talk a little bit about what your vision could be for, as a CRO, someone who drives revenue in terms of being able to make informed decisions around your clients, around your markets, and so on?
As a consultant, having accurate insights of the business, the sales, the operation of our clients, their sales channels, their customer behavior, as consultants, of course, we can really help our clients enhance their ROI and their KPI. As a salesperson, having the information on what their needs and desires, I can put together a better advertising campaign, marketing campaign, better strategies on who to target, and understanding, do I go after the seed stage companies or do I go after the Series C and above, and what types of services and offerings can we provide at you know, at the same time of the market. And in terms of consulting, we can also use AI to improve our service delivery. We could use better recruiting tools, sourcing candidates faster and better, possibly. So there are, you know, definitely many, many ways where AI can enhance our business. We are in a business planning stage for 2020 right now, and we would love to have, you know, the perfect data, right? All the data of all the clients we've had, what their needs are, where the market is going. So that would be a really, if I had, what, 100K, how much does it cost for me to have that information?
So Mel, could you just quickly speak a little bit to how you envision the future of healthcare from a data perspective, and especially from artificial intelligence, based upon what you said?
I wish I had that, you know, the vision to see what's going to happen. But I would say, you know, healthcare, it's all about, you know, regardless of which side of the aisle you're in, you know, it's $3.5 trillion that's being spent each year in the United States. So it's all about either, you know, to reduce the cost is keeping people healthy. The other one is reduce the cost, right? That's the other two sides of it. So I see that from an AI perspective, you know, with wearables coming in, I think that's going to be a big part of it. We'll be able to, you know, keep track of your vitals, to be able to be proactive in making decisions to see, okay, what type of corrective action or behavioral changes that need to happen. And AI could be able to predict, you know, before something's happened, you know, the way the person is walking, you know, the gait analysis, can it predict that somebody is going to be having an issue? And if that's going to be happening, is there a way that they could be now communicating directly with a hospital? There could be AI that's being used where they can send a chat and automatically using natural language processing, it'll figure out where the, you know, where should they route this patient or person to. And then finally, to be able to get the right type of care. You know, AI, I think, is going to be the way, you know, today, you know, radiology and other technology for services are being, AI is being used to, you know, decipher normal versus abnormal issues. I think that's kind of where the direction's going to be, especially in healthcare, especially with the shortage being predicted of, you know, 50 to 150,000 by 2032. I think if you don't use something like AI, I think it'll be a huge issue for us in the United States in the healthcare setting.
And Reza, could you specifically, since this is an audience of both startups and investors, and since you're based part-time in the Middle East, and there a lot of the capital here comes from the Middle East, could you tell us a little bit about how your LPs and how the region in general is looking at AI investments and the strategy forward?
Absolutely. So first of all, AI is very loosely used, I think, globally. It's when big data first came out. Every company that came across my table was, I'm a big data analytics company. Now it's, I'm AI, machine learning with no data, and I've been open for 2 days. From a country perspective, I think the UAE has done one of the best jobs, specifically Dubai. So I work very close with the government there. They've taken AI to a whole nother level. So Healthtech is one of the biggest areas, from the pharmaceuticals, the clinics, the clinicians, taking all that data to everything you just said to better improve. You know, they have, Emirates itself is broken out into about 350,000 Emiratis, but there's 5 million expats. So this is broken out globally. Now, all of these guys, before they come in and get a residency or have any kind of immigration, they have to go through a process. They take all of this information, and this is where the recommendations come in. So they know exactly who, what, where, and how people are thinking. Based on that, they bring in the products and services. So the platform they built is very AI-enabled, if you think about AI from a data perspective. And as they start to grow the city, and one of the biggest things that's coming now is Dubai 2020 for the World Congress, is getting these things to the next stage. So exactly what are people doing? How are they spending their money? What types of things do they need, from construction to healthcare to media, to whatever it might be, to even the type of car that they might want to drive and how the roads are structured. So that's how they're utilizing AI. So from an investment perspective, the families that I'm working with, they're looking at new and upcoming technologies out here in all of those industries from, again, health tech, fintech, IoT, and transportation, and some micro-transportation as well. So when I speak to companies here, I see what their potentials are in the Middle East and find them the right outliers from a perspective of finding, let's say, a pharmacy that's looking for a product out here. I'll get them 3 to 6 months of funding and get them enabled, set up, and then they're ready to go.
Thank you very much, and thanks to the panel. Christina, Mel, and Reza, you've been fantastic. And thanks for opening our eyes.